And we are continuing with our talk about osteogenesis imperfecta and some of the related diseases such as Marfan syndrome and Ehlers-Danlos syndrome. And we're now going to talk about elastin and fibrillin, which also occur in the extracellular matrix. The skin, blood vessels, and lungs are tissues which, in addition to withstanding shear forces, must also be flexible and elastic, flexible or elastic. These tissues have a network of elastic fibers in the extracellular matrix that makes them resilient, permitting them to return to their original shape after being stretched. For example, blood vessels swell and recoil during systole, and the lungs enlarge during inspiration and recoil during expiration. And of course, everyone has observed the ability of the skin to stretch and return to its normal shape. The main component of elastic fibers is elastin, a protein of approximately 750 amino acids, the majority of which are hydrophobic, which shun water. Cross-linking creates networks of fibers and sheets. The elastin core is covered with a sheath of microfibrils associated with a number of glycoproteins. One of these glycoproteins is fibrillin, which has achieved notoriety as a protein that when mutated is responsible for causing Marfan syndrome. Marfan syndrome is associated with tall stature, thin extremities, lens dislocation, and a potentially life-threatening tendency towards aortic wall rupture. Now continuing on, let's talk about genetic defects that produce osteogenesis imperfecta. Sequencing of genomic DNA has shown that most patients with OI have mutations for genes for the pro1 alpha, for the pro-alpha 1 chain and the col1a1, or the gene for pro-alpha 2 chain, or type 1 procollagen, which is inherited in an autosomal dominant manner.